anteriorly. But now we face the challenge of how to bring the IOL in the anterior chamber without compromising the bag. And therefore, the IOL was brought out into the anterior chamber through the area of inferior zonular dialysis. Dialing was carried out. A capsular tension ring is inserted to stabilize the bag. We can also notice that the lens orientation is upside down, and therefore it is flipped back into the correct orientation and dialed in the back. A final adjustment is made, and as can be seen, at the end of the surgery, the IOL is central.
So, nicely managed. Dr. Chi, would you like to comment on this? You love doing these acrobatics inside the eye, and this was unique, yes.
I think this was fun to do. And it was pretty innovative that you put it back up to the front of the eye through your zonular dehiscence, which I've never seen done before. And as usual, when we pick them up, they're always upside down. I don't know why. And it was nicely flipped around again. And I was just wondering whether that, you had 4 to 5 clock hours of zonular dehiscence, whether you thought it might be necessary to just anchor that to the sclera through a tension segment
The
or
bag was
something.
quite stable, and the dialysis was from 3 o'clock to 6 o'clock, so about 90 degrees of the general dialysis. So CTR ring fixed it quite well, actually.
What's peculiar is why did it go behind in the first place? Like if it was in the bag, how it managed to come out of the bag and
how
dive
did it
in?
go behind the intact? So let me get this straight. Capsular bag is intact, correct?
Yeah.
So how did the lens end up on the retina?
So probably at
In
the
the
time of
sulcus.
surgery, the surgeon has missed the dialysis part. So maybe they have implanted the lens into the sulcus.
And
So the
slipped in.
take-home message is when you do the surgery, you must identify the dialysis and try to use the CTR ring. Never put the single-piece hydrophilic lens into the sulcus because it can go through the zonule. So use a 3-piece lens instead if you don't have the expertise of that. And use a CTR ring and try to put into the bag, not in the dialysis, especially into the inferior location of the dialysis.
So whenever the capsule is compromised, as in this in terms of the zonal
Probably at the time of surgery,
you
most
have a
likely.
CTR
It was a
put
referred-
in.
it-
Would you prefer a hydrophobic acrylic lens rather than a hydrophilic
If you're using a
lens?
CTR ring, hydrophobic single-piece lens you can use. or
No,
a
no, what I
3-piece
meant
lens.
was, would you have taken this lens out and put a hydrophobic acrylic lens in this bag?
To remove this and then see why to disturb the anatomy. If you can manage with the same, we are putting into the bag. We are least disturbing the all anatomy of the system.
Because
The
the
idea is to
hydrophilic
have
lens
the least
will not
distortion of the
resist
anatomy.
capsular contraction the same way as a hydrophobic acrylic
They do
lens
as
does.
well. You can do the yak-a-fluotomy later on.
Boris wants to say something?
It's a tough case because we were not seeing the bag clearly during the procedure, and that I had the perception that the bag was not intact.
Intact, yeah.
And my feeling was that it was taken, the lens was taken out through the but of course what we see on the video sometimes does not match what you see under the microscope. So that might be the case. My concern, if that was zonular dialysis, so it should be a massive zonular dialysis for the lens to go through. So
It
it's
wasn't
a
that
6
big
millimeter
enough, yeah. It
optic
wasn't that
lens.
big.
So my question is whether regular CTR is enough to support this zonular apparatus, because in that case I will probably consider using either the segment or modified CTR, because I really think that it's not enough for the regular CTR to support that bag in case of such a massive dialysis.
So, but in this case, the challenge was to basically to manage to take it out and then plan your surgery accordingly. So, being if it is a PCR, it's much easier to take out through the PCR and you can plan your surgery accordingly that way. So, but in this case, because the entire PC was intact, the bag was there. So, we thought to use the bag in the surgery.
Thank you. Thank you, Dr. Abdi.
Thank you.
Please. Can we have Dr. Sohail?
You want to ask answer?
Why not use 2 CTR instead of 1?
Because they will do the same thing. Yeah.
No, it will give you
The-
more protection.
Yeah, because if